So our next one is Jackie Madsen, who works at University of Jamestown in the PT program.
Hi, I'm Jackie Madsen. I'm a physical therapist. I'm also a professor at the University of Jamestown Physical Therapy program, and I teach the neurological content for the program. So physical rehab 1 and 2 and neuroscience, and then I teach geriatrics as well.
All right, so the first question that I have for you is, how do you think practitioners benefit from interprofessional collaboration?
I think practitioners benefit from interprofessional collaboration because we learn more about the patient that way. So all of us have a unique role that we play when working with a patient. Some of us are looking at cognitive deficits, other people might be looking more at ADLs. You've got usually a psychologist on board that's looking at that side of things, and when you all come together for a team conference to put your thoughts and ideas together, you just get a better idea of who the patient is and what their needs are and how to get them home as quickly and as safely and successfully as possible.
Okay. So the next question that I have is, how do you think patients benefit from the interprofessional?
You know, those two things are closely tied because it's really kind of helpful for everybody when the team's working together. I think that each type of therapy brings a unique perspective to the patient case, and we all see something a little bit different, but we're all working for the same general goal, which is the best outcome for the patient. And so I think that the patient gets the best care possible because we get to understand the patient from multiple different lenses. Team conferences, when the team gets together and we all talk about our piece and what we know about the patient and what we found out, really helps inform all practitioners so that we're all doing a better job of making sure our care is individualized and we're meeting the biopsychosocial needs of the patient to ultimately optimize their function, get them home quickly, and maximize their outcomes.
Very cool. Yes. And then what are some main challenges with interprofessional collaboration?
I think the biggest challenges have to do with like payment and timing and how you are going to bill for services. When I've worked in places where I've co-treated with other interventions, it's tough because you schedule, say, a half an hour session with the patient and you're co-treating with OT, and each of you can only take one unit then. And so you've got a unit of productive time, but then you've got a whole unit of time when you're not productive. So it's only going to work well in a facility that understands the benefits of that, and they're okay with you maybe not having like maximum productivity because you are co-treating. Mm-hmm. So if you're in a facility where the patient's needs really come before the billing and the productivity, then it works well. But otherwise, it can be a challenge because you have to watch how many co-treats you're going to schedule in a day if you're only going to be half as productive when you're co-treating. I think that would really be it, though. I mean, I've always only benefited from working with another discipline.
Okay. And then the last question that I have for you is, why don't you tell us about a time that you've had experience with interprofessional collaboration?
Sure. Well, I worked most of my career in inpatient rehab, and so every patient had interdisciplinary care, which was amazing. So specifically, I guess I can say I had like one really cool treatment. Usually we didn't co-treat with speech very often, but I did have one patient with a really dense stroke that had global aphasia, and it was really difficult to communicate with the patient, both his understanding my cues and responding to them, but me understanding what he was trying to say to me as well. So we had speech come to the session, and so I was walking with the patient and holding on to the patient and facilitating the walking and giving the cues, and then speech was evaluating, you know, what's going on here with the communication and how can we make this better to help the patient walk better. And it did ultimately. She gave me some good tips for how to get the patient to respond to what I was saying and to help me understand what he was saying too, based on what she was saying in her speech sessions. And then I guess with OT, I've just done lots of like coma stim with OT, where I'm working in the back with a patient, helping them sit, assessing their postural responses, and OT's doing a lot of the sensory stim up in the front, but that's always fun and always a better session with two people.
Very cool. Thank you for your time and your input about interprofessional collaboration.
So next we have Rachel Stotts, who has her Certificate of Clinical Competence in Speech Language Pathology.
So can you tell me how you believe practitioners benefit from interprofessional practice?
One of the things that I think is most beneficial is your ability to learn about other professionals, so you're able to treat clients, patients, students more holistically across everything. As you learn more about other professions like OT or PT, you can start incorporating some of those things subtly into your practice. Me being a speech language pathologist, I would hope that those professionals could also include the things that we're working on in our sessions for speech and communication with their motor needs or their attentional needs or whatever. There's lots of overlap between OT and speech, and there's certainly a lot of positioning things that I've learned across the years that have helped me be better at serving my clients, patients, students more holistically.
How do you think that patients benefit from interprofessional practice?
Again, it goes back to that whole idea of when we're not in these little silos, we can be holistic. And if we're all looking at the big picture for the clients, they're going to get more carryover activities or focus. There's going to be people looking at what's going to be more helpful to them in terms of achieving their goals and objectives. And as a whole, I think the more we view our clients, patients, students as whole people, we're going to be able to serve them better, and they're going to make progress faster because of that.
Okay. What is one of the main challenges you see with interprofessional practice?
One of the main challenges, especially being at a university, is not having access to the other professionals. So we have been very creative across MSUM and UMary and University of Jamestown PT program on making it a possibility, but I think the more the professions are closer in proximity, the more you could facilitate a bigger picture, more overlap, more interdisciplinary work. And that would hold true with special education for us and nursing and other professions too.
Tell me about an experience you have had with interprofessional practice that has had an impact on you.
I think one of the best, well, I've worked in lots of different environments. In the schools, I had a lot of interprofessional with special educators, classroom teachers, paraprofessionals. And in that setting, when we all worked together, more people knew what the child was working on, more people could prompt and guide, more people could draw attention to or report on progress, and that was better for that individual. Then I went to private practice. In private practice, I worked very closely with occupational therapists, physical therapists, and lots of different community professionals, and the same held true. If I had a question about fine motor or sensory needs, I could stick my head out the door and call in an OT for a consult. If I had issues for gross motor, I could reach out to a PT and say, can you take a look at my client? And just having that close proximity with them and being able to co-treat, sometimes I would co-treat. I think all of those are better for the individuals that we serve when we're all working together.
So now we will show you a video of a patient examination from the lens of an OT and a PT, and we'll talk about this patient from the speech lens also. So first we'll watch an OT evaluation.
The one thing I have done.
Is there anything that you maybe wish you could do a little more easier?
one thing I have noticed over the last few years, my handwriting is not as good as it used to be.
Okay.
When you figure I was a special education person, I filled out a good many evaluation reports and IEPs,
Yes.
and I couldn't have done that now.
Right.
So,
So what do you feel like is affecting your handwriting? Is it like weakness or do you have any tremors?
no, I'm just not very coordinated.
Okay.
I don't have tremors, and I can hold my pen.
Yeah. Yeah. Do you feel like it's okay to hold on to it? It doesn't like slip out of your hands or anything? Yeah, I mean, it's on a little bit.
Yeah, I can hold on to a pen.
Yeah. Here, maybe I'll just have you
Oh, sure.
just like write something. Your name and just a simple sentence like today is Friday.
Okay. And I print now all the time.
Okay. You used to write in cursive?
Well, yes, I did, but I started printing.
Okay. Yeah.
So it's good that I can communicate with with friends online, because
Yeah.
it would take me forever to.
To write.
Yeah.
Yeah. So when do you do most of your writing?
I don't do very much.
Not anymore.
I make a grocery list.
Okay.
Yeah.
Yep.
And I say, sending a card or an
Yeah.
address, I mean, I do as little as I have to, but
Mhm.
things that are necessary, I do.
Okay. With your handwriting, it's mostly fine motor skills, obviously. Is there any other things that you do during the day with your hands that have been becoming more challenging? Maybe like opening pill bottles or opening toothpaste or applying makeup or
I can't open my water bottle.
Okay.
Isn't this stupid? I have to have somebody open it for me.
yeah, okay.
But I can get a gripper and I can open it just fine.
Yeah, grippers help. Okay. So with your medications or anything?
No, they're fine.
They're fine.
I think they must not give me those child-proof.
Oh, yeah. Yeah.
Yeah, I can open all those.
Okay. And you're-
Just sort them out. Put
Yep.
them in my pill box.
Yep. What is your pill box like? Is it just kind of, oh, right there? Just
I
flips
have-
open?
PMs and AMs.
Okay. Can you show me how you open it up? Okay. Yeah, that's pretty easy to access and you just dump them into your hand.
Yep,
Okay.
you just take them.
Yeah. Well, that's good. That's
I've used your pill box for a long time.
yeah. They're nice to.
Yeah,
I see you have some stairs there. Do you ever go downstairs?
not very often.
No. Okay.
That's my husband's toy room,
Oh,
John.
his toy room.
Oh, he builds things down there.
Okay.
And you hear him pounding. But I do go down. I was down not too long ago.
Okay.
But there's no reason for me to go down there.
Right.
That's where I keep my junk too.
Okay. Okay.
And there's 2 stairs from our garage into the hall.
Okay.
And those are
And
fine.
those are okay for you?
Yeah.
All right.
Yep, I've got railings up.
Yeah. Good. That's good. It'll be nice and safe. Maybe would you mind just kind of showing me your kitchen? And maybe, because you like to cook, maybe just kind of show me where your stuff's at and
Oh, okay.
just see. I just want to see your setup. Can you show me how you would maybe just get a gallon of milk out of the fridge? And then if you'd like bring it to the table.
I could, but I usually will fill it right on the counter.
Okay. Okay.
I'll take it over here.
Yeah.
So,
Over there and done. reach?
Yes.
Yeah.
And that's been bad with my sciatic nerve.
Right, I bet.
But now I can do it.
Okay.
Yeah, it's,
Grab from the bottom
sure. Oh, it's my pop is, my chili,
there.
salad dressing.
Okay. Do you ever put dishes in the dishwasher up and
Yes.
away?
Yes.
How does that go?
It goes fine.
It goes
And they go right here.
Okay.
And the dishwasher's here.
Yep.
Pretty easy.
Easy to, you like that? How about getting stuff in and out of the oven?
If it's heavy, I have to do it.
Okay.
I'm really cautious about
Yeah.
lifting something that's burning hot.
Right, yeah.
So I'll let him, but I did some bread yesterday. I got it out of the oven.
Okay.
It's fine.
Maybe you could show me how you do that.
No food. Well, my dog is spoiled. She has to have filtered water
Oh.
from the fridge.
That's nice. I'm sure she appreciates that.
She does. I'll give you a couple crumbs. She's had enough. She doesn't really want it.
No, that's okay. Thank
Now,
you.
want the water?
Sure, yeah. If that's all right with you.
I learned not to fill it too full
That's a good idea, yep.
because it works.
Yeah, you're doing really well. As long as it works for you, that's all that matters, right?
I gotta feed my dog.
Yes.
There you go, Rosie. Nice cold water. Is this slow enough? I'm up.
And ready to go.